Welcome and thank you for joining today's webinar for the global launch of Outbreak READY2. Thisland.
Basika, we're having trouble hearing you.
Apologies.
Okay, I'm going to get, it's okay.
Welcome and thank you for joining today's webinar for the global launch of Outbreak READY2, Thisland in Crisis, hosted by the READY Initiative, which is funded by the Bureau of Humanitarian Assistance. During this webinar, we encourage you to ask questions using the Q&A function. We are happy to provide live interpretation into French for today's webinar. If you're interested in listening to the session in French, please click the globe icon that says interpretation at the bottom of your screen and select French. Access to today's recording will be available after the webinar on the READY website at ready-initiative.org. It is now my pleasure to turn it over to Dr. Paul Spiegel, Professor of Practice and Director of the Johns Hopkins Center for Humanitarian Health. Paul.
Thank you. Thank you very much, Basika. And welcome, everyone. We're morning, afternoon, evening, wherever you may be. We're thrilled that you've joined us today. This is the global launch of the READY Initiative's new digital simulation, Outbreak READY2, Thisland in Crisis. So we're excited to share this simulation with you and to outline the various ways that you and your organizations can utilize this tool. And it really is a unique tool that we've developed. So the Johns Hopkins Center for Humanitarian Health led the development of this READY digital simulation in collaboration with other READY consortium partners, including Save the Children, Johns Hopkins Center for Communication Programs, UK Med, and the Humanitarian Leadership Academy. We have been so pleased with the positive feedback that we've received on our first simulation, which was Outbreak READY. And that was primarily a simulation that was made for NGOs and coordinators in the field. It's been utilized by numerous partners throughout the world. This simulation, we're concentrating on health and humanitarian health professionals. So we have a mixture of technical and operational decisions that people are going to make, all within a special outbreak within the humanitarian setting. And so with that short introduction, we're thrilled to have you, and I'm now going to hand it over to Hannah Hamrick of CHH. Thank you.
Thank you, Paul. And thank you all again for joining us today. My name is Hannah Hamrick, and I am a Senior Project Manager at the Hopkins Center for Humanitarian Health, and I led the development of Outbreak READY2. So please also feel free to introduce yourself in the chat. We'd love to hear from you and where you are in the world as well. Before we begin, I'd like to introduce a few of my colleagues who are on the call with us today. We have Laura Cardinal from Save the Children, who's the Chief of Party for the READY Initiative. We have Catherine Bertram, a Senior Social and Behavior Change Advisor from the Hopkins Center for Communication Programs. And Catherine led on the development of the risk communication and community engagement content in the simulation, which you'll hear more about. And then finally, we have Lindsay Salem-Bango, a research associate with the Hopkins Center for Humanitarian Health, who led on the development of the health technical content in the simulation, and who you will hear more from later in the presentation. And Laura, Catherine, and Lindsay will also all join us for the Q&A at the end of the session. So just to briefly share an agenda for this webinar, I will first present an overview of the Outbreak READY2 simulation. Then we'll do a demo of just a small portion of the simulation so you can see what it looks like and how it functions. Then my colleague, Lindsay, will outline how you and your organization can use Outbreak READY2, Thisland in Crisis, and all of the different tools that are available to you to facilitate it. And then finally, we'll do our best to keep about 15 minutes at the end for any feedback or questions you have. So as my colleague Fasika mentioned, feel free to post those questions in the Q&A and we'll get through as many of those as we can. So as a starting point, Outbreak READY2 Thisland in Crisis was developed as part of the broader READY initiative consortium. And READY is a global initiative funded by USAID's Bureau for Humanitarian Assistance. The project is in its 5th year and works to augment the global capacity for major disease outbreak response. And it focuses primarily on strengthening the capacity of international and national NGOs to respond to infectious disease outbreaks in humanitarian settings. And just to mention the partners again, the READY initiative is implemented. It's led by Save the Children and implemented by the Hopkins Center for Humanitarian Help, the Hopkins Center for Communication Programs, UK Med, and the Humanitarian Leadership Academy. So for more information about READY, one of my colleagues will post a link to the website in the chat. And then we'll share a bit more about the resources and tools available from the READY initiative at the end of the webinar today. So shifting now into the Outbreak READY simulations, READY has developed 2 simulations. The first is Outbreak READY, which was launched in 2021. And some of you may already be familiar with this tool. It's an award-winning simulation that's been played by over 3,200 people in over 100 countries. And it's being utilized by international and national NGOs across the globe, as well as academic institutions. Some of these institutions include Yale, Columbia, and Harvard universities, the Johns Hopkins Bloomberg School of Public Health, the Prasanna School of Public Health, as well as the University of Geneva, all of whom are incorporating that first simulation within their humanitarian health curricula. And today, we are proud to officially launch Outbreak READY2 Thisland in Crisis, which actually won its first award, the Brandon Hall EdTech Excellence Award, last week. And this is an award that acknowledges innovative and cutting-edge trailblazers in educational technology. So as a starting point, what exactly is Outbreak READY2? It is a capacity building tool for humanitarian practitioners that uses serious gaming technology. So meaning that it's built like a video game, but it's also educational and realistic. The simulation follows an evolving infectious disease outbreak from its first detection to its widespread throughout the community. And the simulation, it's a branching narrative game. So the choices the learner makes while playing dictate both what happens within the game and the overall outcome of the broader outbreak scenario. So this type of experiential play, it really allows learners to be exposed to the pace, the stressors, the many different stakeholders, and the types of decisions and challenges that are involved in a real-life outbreak response. It also provides opportunities for players to receive feedback, both throughout play as other characters respond to the choices they've made, and then in a more formal evaluation at the end of play. And this feedback comes about all the different choices and decisions that the player is making. And overall, it provides an opportunity for learners to practice their skills, and most importantly, to make mistakes and learn from them in a realistic yet virtual environment. So why did we develop a digital simulation in the first place? The first simulation, Outbreak READY, was originally intended to be in person, but due to COVID-19 travel restrictions in early 21, we pivoted to this online version. And first, it allowed us the opportunity to explore utilizing an innovative pedagogical tool within the humanitarian sector. And secondly, it allowed for the platform to reach a much broader global audience, as the simulations are available to access for free via the READY website, and they're also built for use across the globe within low bandwidth contexts. So based on these 2 considerations, and on the wide usage and success of the first simulation, we decided to create a second digital tool. So just to briefly look at some of the different pieces of the development process, I'd like to first acknowledge and thank Anne Range, the Netherlands-based serious games studio that we worked with to design both simulations. I believe our colleagues Frank and Elamika are on the call today, and Outbreak READY2 would certainly not have been possible without the Anne Range team and their innovative designs and creative contributions to the project. So it took us over a year to develop Outbreak READY2. We consulted with a large group of READY subject matter experts for sectoral specific inputs. So this included nutrition, health, food security and livelihoods, and WASH. Also, we had subject matter experts for input on cross-cutting themes, for example, child protection and risk communication and community engagement. We worked with this large group first to determine the target audience and the learning objectives for the simulation. And then from there, we really built out all the specific characteristics of this fictitious humanitarian context and the NGO program portfolio. So who is this NGO? What are the different sectors they're working in? Which parts of the country are they working in? It was definitely a really unique project of world building as we pieced together all of the different elements of this broader scenario. We held a pathogen working group that developed the novel pathogen and the epi model that is the backdrop for the outbreak scenario that's occurring within the narrative. And one goal we had was really to have a high degree of fidelity in how we depicted the daily life of the health program manager. And this was really the starting point for developing the actual user interface. So we worked with Anne Range to consider, how does a health program manager gather information and make decisions during a response? So who are the stakeholders that they're engaging with? What are the key dilemmas and decision points they're faced with? And really importantly, what are some of the key pitfalls and mistakes that occur within a humanitarian health response? And how could we incorporate some decisions around those key areas? And the final aspect of development, which I will share about here, is that we did extensive play testing all throughout this development process. We've had both internal and external groups of play testers. This included humanitarian professionals, advisory group members within READY, serious gaming experts, professional war gamers, representatives from the World Bank and UN agencies, and also individuals from international and national NGOs at the implementation level as well. And we really appreciate the time and effort from all of these different individuals, and all of their input really helped us to improve the simulation all throughout this iterative development process. And I would also like to thank one of our colleagues, Professor Rex Brennan, a serious gaming expert who advised our READY team all throughout this development process. So to shift now to the content of Outbreak READY2, as I mentioned, the simulation follows an evolving outbreak from its first detection to its widespread transmission throughout the community. And the target audience is NGO health program managers and coordinators and other humanitarian health staff. So this includes RCCE staff and community health workers as well. In the simulation, the player takes the role of a health program manager, leading a clinical and community-based health response for an NGO called READY that operates multi-sectoral programs. And the events in this simulation, they take place within Thisland, a fictitious low-income country that has recently experienced civil conflict and mass internal displacement. So the learning objectives for the sim, they really focus on the health technical skills that are critical to outbreak response. So those specifically are how to interpret and apply epidemiological data to inform the clinical and public health response. They also how to effectively communicate with the affected communities and incorporate their input into the outbreak response plans and interventions. And then finally, how to minimize risk to staff and the affected population during the outbreak. Outbreak READY2 takes approximately 3 hours and 15 minutes to play, though I will say that's very dependent on the individual player since it's a player-led simulation. So that really depends on the individual playing, but that's an average timing for it. And it's currently available in English, but French translations will be available in January 2024. So here you can see a brief overview of the events in the simulation. We didn't want to give too much away, which is why there are question marks all over the slide. But the simulation is divided into 3 chapters. The first focuses on the initial response to rising cases of an unknown illness before a novel pathogen is identified. So in this scenario, the novel pathogen is called any virus, which is a fictional henipavirus with a high case fatality rate that spreads via respiratory transmission and from eating sap contaminated by bats. Then in the second chapter, the outbreak is worsening and rumors are spreading throughout the community. And at this point, the player joins the RCCE officer on a rapid assessment within the different communities where READY works to inform the development of an RCCE strategy that they're working to create. And then in the third chapter, you see many different challenges arise both within the READY clinics and also within the community as READY is continuing to respond to this outbreak that's worsening. And the simulation concludes with an epilogue. The player jumps forward in time and has the opportunity to consider how their actions has impacted their team, the primary health clinics that they've been managing, and the broader outbreak scenario. So at this point, we'd like to transition into a brief demo of Outbreak READY2, just to allow you the opportunity to explore the tool for yourself. So first, we'll watch the introductory video, and this is the video that plays at the outset of the simulation. And we'll go ahead and play that now.
You are the health program manager for READY based on Burrell, a city in the northeast of Thisland. READY is an NGO providing humanitarian assistance with a focus on primary healthcare, nutrition, food and livelihoods, and WASH. Thisland is a low-income country. Despite its human and natural resources, it struggles with many challenges. 5 years ago, the country suffered from a period of violent conflict in the west, displacing over 250,000 people to the eastern province. 3 years ago, Thisland grappled with the regional HXNY influenza epidemic, which killed thousands. Since then, the country has suffered from economic crisis, political uncertainty, and the return of sporadic violence to the western border region. This has caused tens of thousands more IDPs to flee to the east. In partnership with the Ministry of Health, READY's health program supports 7 primary healthcare clinics, 1 in Murel, 2 in nearby towns, and 4 in IDP settlements. You also work in close partnership with a national NGO, Thisland Relief, supporting the community health worker program and other activities. As the health program manager, you report to Nia, the READY team lead in Murel. You and your health team must be ready for anything. There's never a dull moment in Thisland.
Okay, give us just a moment as we shift the screen share, because now I'm going to show you just a brief demo of the actual simulation. So give me one moment. Okay, let me unmute so you can hear it. All right, and we'll begin. So as you can see, we're jumping into the second week of chapter 1. And here you can see the map. That's the backdrop for the user interface. This is a map of the northeast of Thisland, where READY primarily works. And as you move through the simulation, these and other locations will become available to you. And you're able to go and to meet with colleagues within READY. Also, you meet with members of the community and other stakeholders that are involved in the outbreak response. So you can see here that you have your phone where you receive text messages throughout. You have your computer where you'll receive emails and there's files for you to review that come in all throughout play. You have a Tea Corner where you can go and you hear conversations from that Ready staff are having just in an informal way to hear their perspectives on the outbreak. And then you also have these colleagues that you're able to communicate with. So you receive advice from them, you coordinate with them all throughout the outbreak. And they are grayed out, like the RCC officer here, when they're unavailable, and then in color when you're able to click on them. So you have your Ready team lead, you have a child protection coordinator, and then the health data management officer. Over here on the right, you have key decisions that become available at different times throughout, and the player can decide when to make the decisions or if they want to spend more time gathering information with other people and interacting with other people before making the decision. So you'll see how that plays out in just a moment. But I also want to flag on the interface, you also have this tutorial, and it comes at the beginning of play, but it's also something that players can always come back to access if they have any questions about how to navigate the interface. So just jumping in first to the files that you have available to you. There is an extensive amount of background documents, which we encourage for players to read in advance and that we make available on the Ready website. But just to look at a few of those, we have internal documents for the organization Ready. And here you have the organogram for the organization, you have the broader team, and then you also have the health team. So here the player is as the health program manager, and then all the different members of the Ready team that are reporting to them. We have the Ready humanitarian program portfolio, and this document outlines the different places in the country where Ready's working and the different sectors they're working in. So they operate in the health, nutrition, and food security and livelihood sectors, and then also with child protection mainstreamed and with a focus on RCCE as well. So jumping back, here you have background information on the country of Thisland. You have a Thisland country brief, which outlines the demographics, the economics of the country, the population data. It gives the history of the current conflict and the displacement that's taken place. And then finally, the last one I'll show you is you have this document, which is the profiles of communities in the eastern province of Thisland. And this outlines the demographics and livelihoods, economics for the different groups that Ready is working with in the northeast of the country. So jumping back to, we'll go to our emails now. So we have two emails at this point. The first we'll look at is from Sonia, a Ministry of Health official. And she is telling health partners that the cause of these unknown illnesses, which presented in the first chapter, in the first week of chapter 1, which we skipped over, that the cases have been identified as any virus. And she outlines how these cases are evolving and states that this outbreak is underway. So at this point, there are now some additional files available to you from the Ministry of Health. The first is guidance from the Ministry of Health for health clinics. So you have information on disease surveillance, the referral pathway, the isolation and quarantine of contacts. It includes also the testing capacity for the clinics, and then the IPC precautions for health workers as well. And then the final document that you've now received from the Ministry of Health is information from the Global Health Organization on the virus, and it outlines some of the key clinical and epidemiological information on any virus disease. It includes the signs and symptoms, the transmission, the case fatality rate, etc. So moving back, we'll jump to our emails. We have one from Naya, the Ready team lead. And Naya is saying that the Ministry of Health officials are requesting for health partners that are operating primary health clinics to update their internal case management protocols based on that Ministry of Health guidance, which we just looked at. So you may have noticed when we clicked on that email that this key icon popped up, and that indicates that there is a new key decision that the player can make. So if we click on that, we can see that the choice we need to make is to adapt the case management strategy and referral pathways for the READY clinics that we're managing. So we can go in to the key decisions. You can see the subject of the decisions and the different options that are available to you. So as the player, you have the choice to go ahead and make this decision now, or to return back to the interface and to continue gathering more information. So there's a couple more things I want to show you. So we'll go back to the interface just briefly. And here we have the data dashboard. So now that the outbreak has been declared by the Ministry of Health, you have this data dashboard available to you that will update all throughout play. So we have this first EPI tab. It will have an EPI curve of the new suspect cases, the number of new confirmed cases that will continue to update throughout the simulation, as well as all of these different data points. You have a tab with the monthly compiled READY clinic data from across the 7 clinics that READY is operating. And then finally here, you have the risk communication and community engagement data dashboard. And this is information compiled throughout the region, and it updates with different types of information. So here we have community listening data. We have a national poll detailing trustworthy sources for health information. And then we have key recommendations here from the RCCE pillar. So just quickly, we'll look here. We have the opportunity to visit one of the READY health clinics in IDP Settlement 1. So we'll go visit Isaiah just briefly. As you travel, you hear from your driver, Samuel, who's telling you about his family and friends' impressions right now of any virus there. And then you go to just speak briefly with Isaiah, who is outlining some of his key concerns about the referral pathway for any virus cases. And he's requesting that the health program manager advocate for more support with ambulances and to refer suspect cases to the district hospital. So moving back, the last few things I'll show you briefly are going to the T corner. You can just see that you hear staff informal conversations that they're having. We also have the different colleagues I mentioned that you can consult with. So here we have Sarah. She's outlining that many IDPs are mistrustful of the government and are vulnerable to harmful rumors that have started spreading. So she states that you need to proactively develop READY's RCCE strategy to address some of these issues. And then also you have our child protection coordinator, Hasim, who highlights some of the issues the child protection team is focusing on. And he states that his team will work with READY's national partner organization to disseminate adolescent and child-friendly centered information about the outbreak. So as you heard, we have text messages coming in that increase with more and more frequency as the outbreak worsens. But just quickly, we'll look at the text from all of the different NGO health PMs. So you have the different organizations that you're coordinating with throughout the simulation. And then at this point, we can navigate back to the key decision and we can make the key decision. But so as not to give too much away, I'll conclude the demo there. And we'll move back into the presentation, but we hope your interest is piqued enough to go and play the full simulation on your own. So I'll ask that my colleague Fasika goes back to sharing the slides. Okay, thanks, Fasika. So just to highlight some of the other key features, as I mentioned previously, the simulation incorporates feedback all throughout the decisions that the player is making. So this feedback comes via the responses from other characters and as more feedback, more formal feedback on the decisions that the player is making. So after each chapter, players receive an overview of the key decisions in that chapter and the choices they made and why those different decisions were optimal, suboptimal, or bad. So here you can see an example of this from the Chapter 1 feedback screen. And this really just provides an immediate learning opportunity for players to understand why the choices they made were right or wrong within this given scenario. And then I also mentioned the epilogue that the simulation concludes with. It's a jump forward 1 month in time after the last decision that the player makes within the simulation. And it includes a voice message from the READY team lead. She shares feedback for the player specific to the decisions that they've made. The player can also see the final EPI data dashboard, which shows the cumulative number of suspect and confirmed cases and of the probable and confirmed deaths. And these numbers are impacted by the decisions that the player makes. So it shows and it also shows their outcome based on the best and worst possible outcomes that other players may have received. So if you're playing in a group setting, different players will have the different epidemic curves based on the choices they've made. And then one final feature that I will highlight is that throughout the simulation, you also get to hear the experience of Jahiza, a young girl living in one of the IDP settlements, through her narrated sketchbook. So this video, it just allows you to hear the perspective of a member of the affected community at the different periods throughout the outbreak, and it centers her experience and the experience of her family within this broader outbreak scenario. So we'll now play just one of these videos that plays during Chapter 2, and it takes place while the outbreak is worsening.
Dear sketchbook, I didn't go to school today. My brother is sick, and I heard Mom and Dad whispering. The opening of the youth center is also cancelled. I'm worried that our club will not happen again and that I will not see my friends. I hope the artists still come to paint the mural. My brother is getting worse. He didn't recognize me when I talked to him. It's scary. My parents decided to take him to the READY clinic near our home. I'm not allowed to go in and have to stay with Dad outside. The clinic workers are all wearing masks and gloves, and they give us masks to wear too. Nurse Wazao, who helped us learn about our productive system at the youth club meetings, is now checking people's temperature. I'm worried about my brother.
And with that, I will now hand over to my colleague, Lindsay, who will lead us through a discussion of the available facilitation resources for Outbreak READY2, and she'll also outline ways that you and your organization can utilize this tool. Over to you, Lindsay.
Thank you, Hannah. So like with the first simulation, we will have facilitation resources, including a solo play guide and a detailed manual for facilitating group events. And these will all be on READY's website. The solo play guide supports people who are playing the simulation individually. It provides an overview of the simulation and then tips for playing, like the recommended time to spend per chapter. But most importantly, it provides additional opportunities for reflection on key learning points, both during the simulation as well as afterwards in our post-play reflection. The facilitation manual for group events is a very detailed 80+ page guide on organizing and facilitating simulation events for any kind of group. It provides detailed checklists on how to prepare for such an event, and then it walks you through essentially a sample event, providing minute-by-minute instructions on what you should do when, even a script on what you can say when. The manual also comes with a plethora of supporting materials that also help with these facilitation events, from printable background documents to suggestions on adapting the format of the event to even sample emails for participants. A big piece of the simulation events is the group discussion, where participants can discuss a variety of questions on some of the topics listed here. And these group discussions really provide, again, further opportunities to think critically about the simulation, which not only helps drill home some of those key learning points, but it also helps foster an environment where participants can share and learn from each other's past experiences. And to help facilitators lead these group discussions, the manual also has detailed notes on every single discussion question. The READY website also has a downloadable PowerPoint to even further support you in facilitating a simulation event. So our goal with all of these materials is really to make it as simple as possible to facilitate a simulation event. So with all of these resources in mind, there are many different ways that you can use Outbreak READY2. You can, of course, play it by yourself using the solo play guide. One of the great parts of the chapter structure of the simulation is that you can play it all in one sitting, or you can divide it up throughout the week as you have time. Organizations can similarly distribute the simulation to staff for individual play, or they can organize a facilitated team event, either in person or virtually, using our facilitation manual. And then lastly, as Hannah mentioned earlier, many academic institutions have actually used our first simulation, Outbreak Ready 1, in their classrooms. And you can do the same thing with Outbreak Ready 2. You can either distribute it to interested students for individual play, or you can incorporate Outbreak Ready 2 into your lesson plans. READY has utilized the simulations all around the world. They've been used both in formal simulation events, as well as part of larger thematic trainings, like for RCCE and operational readiness. Actually, just last week, we had an interagency Outbreak Ready 2 simulation event in Ethiopia, and we have upcoming events for Outbreak Ready 2 in South Sudan, Nigeria, and Iraq. And so far, all of the feedback that we have gotten globally has consistently been that participants all around the world have really found it engaging and realistic, and that they really learned from the immersive experience. Outbreak Ready 2 can be paired with other resources that are also publicly available on READY's website. So the READY Resource Library has a vast collection of multi-sectoral tools and guidelines on outbreak readiness and response in humanitarian settings, all in one place. The resources cover about 16 different topics, from operations to gender, WASH, mental health in outbreaks, and they range from general to disease specific. So whether you are already looking for tools and guidelines, or you play the simulation and you identify skills or knowledge that you would like to improve on, the resource library is a great place to check out. Outbreak Ready 2 can also be paired with READY's Learning Hub, which has over 60 different courses on outbreak readiness and response, curated from key actors like WHO and UNICEF. And like with the resource library, you can search for these courses by disease or topic of interest, and they're all completely free and publicly available. The Learning Hub can be found on HIA, which is the Humanitarian Leadership Academy's e-learning platform, which is linked here on the slide. And so again, there are just so many different ways that you can use Outbreak Ready 2, including pairing it with our other existing READY resources. And so with that, we would like to open up to questions in the last 20 minutes. Again, we are so excited and proud to be launching Outbreak READY2, Thisland in Crisis, and we hope that this session has been informative.
Thanks, Lindsay. And excuse me, let me turn my video back on. Participants, you're welcome to raise your hand to ask a question, and we can unmute you and let you ask that question live, or you're also welcome to type it in the Q&A or in the chat. I'm gonna go ahead and ask this first question, and Lindsay, I'll ping this one to you. This is from Isabel, and she asks, what is the difference between Outbreak Ready 1 and 2? Are they different outbreak scenarios?
Yeah, thank you, Isabel, for your question. So Outbreak Ready 1 is more geared towards the higher level leadership decisions that are involved in an outbreak response. So in Outbreak Ready 1, if you're familiar with it, you take on the role of the team lead of Ready. And so the decisions that you're making are some of, again, those higher level leadership decisions. Whereas in Outbreak Ready 2, you are taking on the role of that health program manager. So they're a bit more health technical decisions. They also are different pathogens that we've included. And so everything from the types of decisions to the pathogens are different in those simulations. They do, Outbreak Ready 2 does technically occur after Outbreak Ready 1 in the universe, but you can play them either chronologically or completely independently. You do not need to play Outbreak Ready 2 before playing Outbreak Ready 1.
Thanks, Lindsay. And again, feel free to raise your hand and ask your question. And also, we're monitoring the Q&A for other questions as well, or feedback. We welcome feedback too. And Catherine Bertram, who I introduced earlier, and Laura Cardinal also joining us for this Q&A session.
Hannah, maybe I could add one thing quickly, is just to say I was going to put it in the chat. I see a lot of people saying they can't wait to see it, try it themselves, or try it with their organization, or with their classrooms. And just to say that we know that this is quite a quick overview for you all. If anyone is interested in a more in-depth conversation with Ready on how you can use this in your organization or your classroom, we have lots of great examples of different ways it's been used, and we'd be happy to set up a 30-minute call with you to go over kind of best practices and tips. And so please do reach out to us. I think our contact will be on the last slide, but we can also put it into the chat, and we'd be happy to have some one-on-one calls with folks who are interested. And Hannah, there's another question in the chat. This is impressive. I'm wondering about coverage or the country or other countries that are considered in the simulation.
Wondering about coverage in other countries. So this simulation, as we developed it, we really tried to make it reflective, as generally reflective of a humanitarian setting as possible. So one of our goals was that you wouldn't be able to specifically locate where it is geographically, but generally it would reflect a humanitarian setting and the types of challenges, and then obviously the role that an NGO is playing during that response. But I also welcome my other colleagues to add anything as well. And I see a comment from Maya Ververs in the question in the Q&A. Maya also worked with us on the development of the simulation. So thanks for being here, Maya. And she asked if we could explain a bit more about the duration differences between solo play and classroom events. So Lindsay, I'll ask you to take that one since you talked about the facilitation.
Yeah, great question, Maya. So for solo play versus events, we So for solo play, we recommend taking about 3.5 hours to play. For broader facilitation or simulation events that have longer group discussions, we typically add a couple more hours onto that. Our simulation events, we propose around 5 hours for those events, just to provide participants with plenty of opportunities to have those detailed discussions. So that's the difference in the duration of those events. But in terms of classroom settings, we've also received feedback from professors who have on how they've used the simulation in classroom settings. And some of them have had their students play it, again, all in one big event, while others have broken it up throughout a lesson. So maybe doing one part of the simulation in 1 week, and then another part of the simulation another week, depending on what fit into their lesson plan. Or they've had them play the simulation at home on their own, and then they have that group discussion in the classroom. And so all of these different types of adaptations also work for non-academic events, and they're all also outlined in the facilitation manual for group events under one of our annexes on suggestions for adapting the format of the event. All these different ways that you can tweak the event to best fit your needs.
Thanks, Lindsay. I also see a question about the evaluation of the tool. So as READY, there is a survey at the end of play that we ask for all participants to fill out, requesting feedback about the tool itself and about how it impacted work and the organization itself. We also do a more in-depth survey when we utilize the simulation in one of the specific READY trainings. Like Lindsay mentioned, we incorporate it into our CCE training and our operational readiness trainings. And so we do a longer, more targeted evaluation with participants in those events. And sorry, I got distracted by another question. And then I also see the question here about the different groups that are using it at teaching levels. And so we always ask that academic institutions using it reach out to us so that we can connect and learn about how it's being used. I will say from the different academic institutions I've connected with, it's being used primarily for master's level students at the MPH level. And that's primarily with Outbreak Ready 1, which again is targeting more help or more program managers and team leads within humanitarian response. And we would anticipate this new simulation being utilized at a similar level for master's level students. But there is also, we know of Outbreak Ready 1 being used for undergraduates as well. So that it's really across the board being utilized in different ways in academic settings.
Hi, Hannah. I see a question from Ben that maybe I could jump in and answer. Ben from USAID BHA says, you said this can be used by NGOs. The scenario is set up at the start indicates this land's political and health infrastructure may have collapsed and health resources may have been exhausted. Does this scenario still give deference to the Ministry of Health to lead with NGOs and international community to support? It's such a great question, and thank you so much for that. And the answer is definitely yes. Sonia, who is from the Ministry of Health in Thisland, is a central character in both simulations. Both simulations really try to uphold the leadership of national health authorities to lead outbreaks. I see. Okay, Ben. And so anyway, that thread, as well as the pillar system and the importance of coordination between the humanitarian system and the outbreak system is upheld across both simulations. The Ministry of Health can absolutely use this simulation and has. So we just had an event for this simulation in Addis earlier this week, where we had about 30 people from The Ministry of Health and humanitarian organizations come and play the full simulation and add us with us for the day. That was led by some other members of the team. And they've also joined other trainings and simulation events that we've had for both simulations. So yes, can definitely be used by them as well. Thanks.
And then I see in the comments that there is a hand raised from Raful Hassan. You are welcome to unmute and ask your question.
Thank you very much. Can you hear me?
Yes, we can hear you.
Okay, thank you very much. In fact, I am from Bangladesh and I am basically an MPH student and FETP graduate and working as a field epidemiologist with the government of Bangladesh. I am okay, just a minute. In fact, I suddenly opened your website, so it was talking. So in fact, I want to know one point, that is there any limitation of the students when we will try for the simulation in the class? Or is there any guideline type video where we can learn how to use this in the classrooms?
Yes, that's a great question. And the facilitation manual, which we can actually post the link to in the chat, it outlines an agenda for how you can facilitate the simulation. So it gives you even, a script that you can utilize. It gives you some different examples of how you may want to set up your event. For example, I know our colleague Rex, who utilizes the simulation in his class, he chooses to divide up. So he has his students play a portion of the simulation at home, and then they come into class and play a final portion of the simulation and then have a group discussion. But in that manual, you have a sample agenda, and you have a lot of different discussion questions that you can choose to use. So really all of the resources that would support how to do an event in your class would be in that manual. And again, we can post a link to the manual in the chat. Thank you so much for that question.
Thank you very much. Thank you, particularly as we are from a lower middle income country. So we really need support for our students while we are practicing them about outbreak, and outbreak is very common in Bangladesh. So thank you very much for your support.
Thank you so much. Thank you for being here. And thanks for posting the link to those manuals, Fasika. Are there any other colleagues, Fasika, that have their hands raised at this point?
None that I can see, but feel free to raise your hands if any questions have come up.
I do see a question in the chat about certificates. So at this time, linked to the actual simulation, there's not a certificate that you receive at the end. However, when READY facilitates within one of our events, we do provide a READY certificate for completion. And yes, Hassan, we can put the link into the chat now as well.
Hannah, I see here a question that I might pass on to you. We have a question in the Q&A about if we could perhaps describe in more detail about how participation in the simulations impacts practice. And even maybe if just for Outbreak Ready 1, with what we've seen, how participating in these simulations has impacted organizations. And so as someone who's facilitated a wide variety of simulation events, what have you seen from interacting with organizations who have participated in these simulation events?
Yeah, thanks, Lindsay. I think, as we mentioned, we incorporate this into our operational readiness training and our risk communication and community engagement trainings as well. And I think we always try to merge the content of those trainings together. So we frame the simulations as an opportunity to practice some of the skills that are also being taught in the trainings. And so with the operational readiness training specifically, it really provides the opportunity to to pause in the midst of that training and practice the things we've been discussing. And so we've really had positive feedback from the different organizations that have participated, just that it allows them to experience some of the challenges. We have really vibrant discussions. Honestly, the thing I enjoy most is when we're discussing and we all disagree on what would be the right choice. And we've gotten to some very engaging disagreements about what the person should have done in this scenario. And so it's really just an opportunity to explore those challenges, to make mistakes, or to disagree with the fact that the simulation told you you made a mistake, and just to have really rich discussion around that. And then to have the other pieces of the READY trainings kind of bolster that. I will also say, as we've utilized the simulation in PH classes at Hopkins, it's also been really interesting to hear feedback from students who have less experience working in humanitarian settings, that it's just been really helpful for them to get an idea of what it looks like to be in the role of a team lead or to be in the role of a health program manager, and to have a better understanding of what that role is like, what it looks like to be participating in an outbreak response, and just to be exposed to that in the simulations. So thanks, Lindsay. Yeah, exactly. Rex just put in the chat, that's always the comment that from students, is that there's so many emails and text messages to review. How could we ever get through that? Which we all know is very much the reality during a response period.
And I'm wondering if you want to take the question on the applicability of the simulation across different types of outbreaks, which Asma had asked in the Q&A.
Thanks. I will actually ping that to Lindsay, who was on the health technical side. Thanks for flagging that, Catherine.
Yeah, thank you, Catherine. And thank you, Asma. That's a really great question. The simulation can be applicable to all types of outbreaks. So while the simulation, the pathogen in Outbreak READY2 is primarily driven through respiratory droplets, although also transmitted through consuming infected sap. It's the key challenges that come up and the things that we need to consider when engaging with communities, when setting up isolation and treatment centers, when ensuring child protection, interpreting data. All of those key learning points are very applicable to any type of outbreak. So that's a very great question.
Okay, I see we're almost at time. We only have 2 minutes left. So quickly, I'm just looking if there is an additional question we can answer quickly. Do my colleagues see one?
Hannah, maybe I could address two really quickly
Yes,
here.
please.
So one is asking if the simulation generates a score for each person who plays. So there isn't a score in the classical sense, since this is a learning tool and not a test, I guess, but it does give you feedback on your responses. And there are several outcomes, if you think of like a choose your own adventure book. So there are several different outcomes of how the outbreak sort of progresses in Thisland based on the decisions you make throughout the course. And so, or throughout the simulation. So people who have played can kind of look at the differing outcomes based on their decisions and the feedback. And then there's one other question here about it being mostly for the classroom setting. And I think that is actually not the case. What we are seeing is actually most of the play is happening by humanitarian actors, NGOs, who are playing it either through a training as part of their outbreak preparedness. We have a funny story from some MSF colleagues about a big competition they were having in their office where they were all kind of playing it and talking back and forth. So though some of the questions in the webinar today have been focused on the academic way that this tool can be used, it is primarily for current humanitarian actors who are looking to kind of build their capacity in outbreak readiness and response. Thanks.
Okay, thanks so much, Laura. And that's a good point to conclude. I know we're at time. So thank you so much for joining. And we, of course, welcome you to play the rest of the simulation. If you know any colleagues for that these tools will be relevant for, please feel free to share them. And lastly, I would just say that we also welcome having one-to-one calls for anyone who's interested in learning how you and your organization can use this tool. So you're welcome to reach out to me. We'll put my name and email in the chat, and we're certainly happy to have calls with you to discuss this or anything else with the simulations further. So we really appreciate having the opportunity to share these tools with you, and thanks to my colleagues who joined for the Q&A. And thank you again for your time. Have a great day, afternoon, evening, everyone. Thank you.